Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The basic objective of this exercise is to recontour the pre-made porcelain Pontic on the left hand of the screen to a shape that more realistically simulates the extracted lateral. We will be using a series of special stones and rubber wheels to accomplish this, and once it has been ground to the proper contour, we will do a staining exercise which will allow you to characterize the Pontic on the surface with different types of colorants, and then it will be glazed to the shine that you see on the Pontic on the right and incorporated into the final bridge. This is the basic Brasseler porcelain polishing kit, which is made up of a series of stones and rubber wheels which have a special binder which will not leave black flecks in the surface of the ceramic after it's been contoured and polished. We have two green stones which are used for the gross contouring, and this will allow you to contour the external surface rather rapidly since they are a medium grit and do cut with quite a considerable amount of tenacity. Then there's a series of smaller stones which will allow you not only to smoothen the cut surface but also carve in the details that occur on the labial surface of the lateral tooth. And then we have two stones, or rubber wheels rather, which are used for our pre-finishing shine, and then the pink stone or rubber wheel which is used for the final high shine prior to glaze. There are also two mandrels which are included in the kit which can be used with the rubber and the two green stones for doing your contouring work. Although the lateral and central are similar in their overall shape, you will notice that the lateral actually has accentuated contours as far as convexities and concavities are concerned. And it can be quite a variable tooth as far as shape and contour is concerned. Generally, it's somewhat smaller than the central, although this may not necessarily be the case on any given patient. We can observe some of the basic features of the lateral. You'll notice that as it emerges from the soft tissue, it emerges at what's considered to be a zero contact angle. In other words, it's at right angles to the soft tissue. It emerges into a concavity, into a convexity on the mesial aspect, and then as we progress across the incisal edge, inasmuch as the tooth is developed from a series of lobes, usually 4, we will notice that the incisal edge before it has been subject to a considerable amount of wear usually has a gentle undulation, which is reproduced by the three cusps, the mesial, the central, and the distal cusp or developmental lobes. We cross the incisal edge, and as we progress down the distal aspect, again we go into a more accentuated convexity and then into a concavity as we again approach the soft tissue and into a zero emergence angle as we progress into the soft tissue. At the cervical region, we have what's called a trigrome effect, where we start off on the mesial aspect, progress approximately 2/3 across the tooth to a height of contour of the triangle, and then drop off rather abruptly down to the distal aspect. On the mesial, in the cervical 2/3 area, many times you'll find a slight concavity in this region, and we have accentuated somewhat for the camera so that you can see it. And then up at the incisal edge between each one of the developmental lobes is a slight concavity which gives the surface a somewhat undulating effect here in the mesial aspect and here in the distal aspect. And again, as we get down into the cervical 2/3, many times you'll find a slightly less concave area than on the mesial aspect, but nonetheless it is discernible on many teeth. In the region of the emergence from the soft tissue, many times you'll find an area of striations. These do not occur on all teeth, especially older teeth, since they have been abraded away. But on younger teeth, you will find these striations which occur down at the soft tissue area. This is the basic labial contour of this particular tooth, and if it's followed, and it's similar to what the patient has in its mouth, you'll find that the result will be a very natural looking and aesthetic Pontic, which will be hard to detect from the actual tooth that had been extracted. Our first two objectives in grinding in this Pontic will be to get it to fit mesial distally so that we can move it into place, and then we will recontour the soft tissue area so that it seats properly. You must remember that this is a laboratory exercise, and if we were doing a clinic case, it would be done in a different procedure as outlined in your manual. The substructure or the metal portion of the bridge would be waxed and usually by the laboratory cast as a single unit. However, it could be cast, depending upon the metals utilized, as 2 units and then a third that might be either post or pre-ceramically soldered. As I said, it would be waxed as a substructure, and the tissue portion would be very well adapted to the ridge that was presented by the patient. Then subsequently, the porcelain would be built to the proper contour, shaped and glazed and sent back to you either in what's called a biscuit bake, which is a dull finish, or in this glazed shape as you see here. So our first objective will be to contour the interproximal areas and the soft tissue. And to accomplish this, why, we will use the green stones that we discussed previously, and I have one in the handpiece here, and contour it on the mesial and distal aspect. And then for the metal surface that's going against the soft tissue, we'll utilize the Shofu metal polishing kit. We do not want to contaminate these stones and rubber wheels for the porcelain more than is necessary with metal. We would like to keep them separated so that we don't incorporate any metal into them and leave any residue on the ceramic. So we will keep these two kits as separate entities and maintain a relatively isolated environment with the stones. And you should practice this objective in your practice also, so that there isn't any unnecessary cross-contamination. So let's do a little bit of recontouring, and then we'll come back to the model. To aid us in getting the proper contour or fit on the soft tissue, we can use one of two methods. We can either take a pencil and rub it on our stone cast, and on a certain type of gold, this will leave a mark which is discernible. However, since this is a high palladium alloy that we're utilizing, and the surface is somewhat gray, it's rather difficult to see a pencil mark. So we've taken a small piece of 28 gauge green wax and put it into place, and then when we place the Pontic down and exert a bit of pressure, obviously it's going to leave a mark on the soft tissue that you can see here, and this will give us an indication of where we should grind to get a better fit onto the soft tissue. Let's discuss this grinding sequence once again in perhaps a bit more detail. I have started to rough grind the Pontic that you saw previously, and we must be aware of several things. First, we're basically dealing with a glaseous type material. For all respects, it is glass in essence and must be handled with a certain degree of caution. So we would not want to take a stone and run it across the surface like so in order to reduce this incisal edge, because we would run the risk of possibly chipping that incisal edge. Rather, we would take the stone and hold it in this direction and either move from the mesial to the distal or distal to the mesial, whichever way we're holding the particular Pontic. The same thing holds true in contouring the surfaces. We again would like to move the stone down the surface and either across the surface in this direction or down in this direction. Probably the better of the two would be to move it from the mesial distal aspect. We can also use these stones to do some rough contouring when we get down at the cervical area. If we want to develop this concavity that we were discussing, we can even utilize this larger stone in that respect by holding it and taking advantage of the shape of stone itself, since it is a concavity in negative. We can utilize it in this direction and gently contour that concavity in and utilize the stone very effectively in that respect. We can also use it across the incisal edge if we just use it at a slight angle to develop these undulations, and then we will switch to some of the other contoured stones to develop the surface anatomy. Let's take a look at what we've done to date and see what else is necessary in order to bring this into the contour that we would like to have. As you can see, we're progressing. However, we are slightly large mesial and distally, so we'll remove some of this material, and we'll also have to scoop out, as we saw on the piece of green wax, the underside of the Pontic slightly, the metal aspect, so that it fits better at this tissue area. And then we'll check to make sure that we have the right incisal contour with respect to the central and the cuspid on the distal, and that the overall shape of the tooth is harmonious not only with the two adjacent teeth, but also with the lateral on the other side of the arch. It's more important to have harmony between these two adjacent teeth with your Pontic than it is to try and exactly emulate the Pontic on the other side of the arch. However, there wants to be some compatibility between the two sides of the arch so that this Pontic doesn't inordinately glare out at you and pronounce itself immediately as a false restoration. So let's do a little more judicious grinding at the soft tissue area and recontour this just a bit more, and then we'll come back and see if we can't finish our surface contour and go into our smoothing and glazing portion of the finished product. We have adapted it to the soft tissue. Obviously, we still have a bit more to go here, and we've utilized some of these other stones, trying to pick something that is fairly close to the shape that we would like to generate. We've used this particular stone to put in the two concavities on either side of the lobe on the surface, and then we've used this barrel-shaped stone to contour our surface, and also in these concavities reach in and develop this small concavity on the mesial and distal aspect. You'll notice that we've also simulated the trigome shape at the cervical area somewhat. Now this doesn't want to be an abrupt triangle, and it doesn't want to be pointed down overall towards that shape. You want that convexity, concavity, trigome shape, and back up to the convexity again. We've shortened our incisal somewhat and tried to blend it in with the two adjacent teeth and also with the Pontic on the other side of the arch, and with just a minimal more adjustment to it, while we'll be able to start our finishing phase and then grind in the small knockoff lug on the distal aspect. We have completed our contouring of the surface now with stones, and we have a reasonable adaptation to the soft tissue, not as good as what we would get if this were a clinical case. However, it is acceptable for this laboratory exercise, and you'll notice that we have followed the buccal contour of the teeth so that it isn't protruding, and the lingual aspect will be ground in subsequently after the bridge has been soldered together. We do not want to remove the knockoff lug on the lingual of the Pontic because it will be utilized in a number of exercises. First, it will be utilized to retain the Pontic into the soldering investment, and when we do our staining, we have to have some way of holding the Pontic upright so that we don't encroach on the stained surface. And we've ground this so that it's conical, not conical rather, but cylindrical in shape, so that it will fit into a little tray that has been made. You'll also notice the contour of the soft tissue. This is what's referred to as a ridge lap or a modified ridge lap type of shape rather than a saddle Pontic. We have not attempted to polish the underside. However, we will do this subsequently and do it with our other polishing kit. But now we can take our white rubber wheel first and go over the surface and begin our polishing sequence with this wheel. And it is abrasive enough so that it will remove some of the ceramic, but not a great deal. So we do want to be somewhat careful with it. And you can see we're beginning to smoothen the surface up because it is beginning to reflect light more. And after we've finished with this white wheel, we will graduate to the pink wheel and finish polishing our surface subsequent to our staining and glazing procedure. We have finished our polishing sequence now, and as you can see, we have a relatively high shine on it, and we have left some facets on the surface of the tooth rather than making it completely smooth, although some teeth do display a very smooth surface. But this acts like facets on a diamond and catches the light and highlights it and makes the ceramic look more vibrant. After we've completed this step, we'll cleanse the surface well and be ready for our glazing sequence. And I'll show you a Pontic that has been completed and glazed and also characterized to some extent. It's difficult to see on the television set, but right in this area, we did add just a small amount of white to give the impression of a decalcified area on the two-structure, and then some violet at the incisal edge to make it appear slightly more translucent, and glazed it, and you can see that it does have a very nice, vibrant appearance, and when in the mouth with the saliva, it will blend into the natural dentition quite well. There are some aids available. When you get into your private practice, you might keep this in mind. Should you have occasion to do just a minimal amount of grinding on ceramic and not want to have the patient back for another visit and take the time to have it glazed, there are some diamond materials. This one happens to be from Brasseler and the other one from Ney. And basically what they are, they're a paste with diamond particles in them, and applying this with just a rag wheel will give you a finish very comparable to the glazed state. And as I say, if it's a minimal adjustment, this usually will be adequate to allow you to cement the bridge without going back to the laboratory technician for a final glaze. So this will complete this portion of our exercise, and now the Pontic is ready for our surface staining and subsequent glazing procedures.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.